Hello, good morning, everyone, and welcome. Thanks for joining us on this Monday morning for another episode of House Calls, Real Docs, Real Talk. I am Chelsea Helms, coming to you live from the KNWA News Studio here in Fayetteville, Arkansas. I was just looking at some of our live feed. It looks like we already have such a great audience joining us this morning, and we are so lucky to have you here with us. Now, over the past few weeks, we have been getting tons, and I mean tons of questions from all of you around COVID-19 and how it may affect your heart. That's no surprise since the coronavirus is still such a prominent part of our environment. And so as a result, we decided that in today's episode, we would focus solely on this topic. We are learning new things every single day about this sickness. So this is really a much needed discussion and one certainly important to the American Heart Association. I encourage you, if you do have a question for us, you can go to heart.org/housecalls and submit your question for us there. You can also drop it in the comments during the show, wherever you're watching. Maybe you're joining us right now on Facebook Live or on LinkedIn, and we will do our best to get you those answers. Now, if we can't get to all of those questions during the show, we will tackle even more of them during our House Calls after show, which I'm going to tell you a little bit more about coming up later on. Now, you already know this, but a big part of this show is the involvement from all of you. So today, we're asking you the two things we've been asking you to do with us every single week. First and foremost, throughout the show, we're going to break for a few of our questions, and we want you to respond to us using our easy text to answer feature. All you have to do, it's super simple. Text AHA Live to 22333. You can see the information there for you on your screen. AHA Live to 22333. The great thing is we're not going to ask you your name, any personal information or anything like that. It truly is just a simple way for you to participate with us and kind of engage and be active throughout this entire show. And we hope you'll do that. Now, after you do that, we want you to hit the share button or begin a watch party, whatever's easiest for you on the platform that you are watching us on, so that you can share the stream with your friends and family, because they might not even know what's going on. So why don't you go ahead and do that for us, and we can all have a good conversation this morning. All right, let's go ahead and get started. With me this morning is Dr. Lawrence Sperling, Executive Director of Million Hearts at the Centers for Disease Control and Prevention and Center for Medicare and Medicaid Services. Welcome, Dr. Sperling. I know that you and I were talking prior to this broadcast, and not only are you on the front lines, but you're doing a lot of stuff behind the scenes as well. Can you speak to that?
Thank you, Chelsea. I really appreciate the invitation and opportunity from the AHA to join all of you here today. I am the Executive Director of the Million Hearts Initiative. This is an initiative, a national initiative focused on preventing 1 million heart attacks, strokes, and cardiovascular events in our country. But very much so, I am a real doc. I still serve as a professor at Emory University School of Medicine. I founded our Center for Heart Disease Prevention there. And I served in our hospital for 15 consecutive days during the first peak of the pandemic in April. In fact, I was self-quarantined in our home here in Atlanta for 22 days during this period of time. And I still care for patients each week, both in my clinic and through telehealth and telemedicine. So I look forward to entertaining your questions today and really diving into the potential interactions between COVID and the heart.
Well, it definitely sounds like you're our guide to get through this discussion with us today. So we are super happy to have you here with us this morning. All right, before we do begin our discussion, let's start with our first viewer response question so that everyone at home can take part. True or false, the coronavirus is the #1 cause of death in the United States? I think that a lot of people can kind of assume the answer to this, but why might some people think that this is the truth, Dr. Sperling?
So 100% got that correct. And I think some people might assume this is true because we are bombarded with information every single day about coronavirus. The charts we're seeing across our country, the number of cases, the number of people in the hospital, and those that are dying of coronavirus. And so at this point in time, it is not the #1 cause of death in our country. The #1 cause of death remains heart disease, and stroke is also a leading cause of death during the pandemic. So
and this is for both men and women, correct?
Absolutely, for both men and women. And so although we are focus very much on this pandemic, and we should be. We cannot forget that other health conditions are still occurring, especially chronic disease conditions that can often occur very suddenly, like a heart attack, stroke, or a heart-related problem.
Yeah, definitely a good reminder there. Hopefully everyone at home is kind of listening to you and taking that advice in. All right, let's now get started with our first segment, Health in the Headlines. Each week, we select one current headline that ties back to the topic we are discussing. Here's a sobering one from Health Essentials from the Cleveland Clinic. It reads, COVID-19 can also damage your heart, not just your lungs. So Dr. Sperling, we know the coronavirus, it attacks your respiratory system, but can you talk to us a little bit more about what we're learning in regard to how it affects our hearts?
Yes, this is an important headline. Early on, the thought was that the SARS-2 coronavirus, COVID-19, was primarily going to be a respiratory or lung illness. What we have learned is that we can see a spectrum of problems related to the heart. This particular headline has to do with a paper that was published a few weeks ago out of Germany. And this paper looked at 100 individuals who had COVID. Many of them had not been hospitalized. Many of them had been otherwise healthy, and looked at the hearts with a scan, an MRI of the heart, and found evidence of inflammation in the heart in a large number of these individuals. So this is a single study at a single center, but I think as a cardiologist, we need to pay attention to this and really, we have a lot of uncertainties right now and a lot of unknowns, and we are learning every day.
Yeah, and that's what I hear from a lot of doctors who are being pressed daily on these different conversations. We don't have all the answers we need. We are still very much so in the beginning of this. All right, let's move on to You Ask, We Answer. And You Ask, We Answer. We address your health concerns live. As we are talking today, as I mentioned earlier on in the show, you can submit your questions in the comments section or submit them to us on heart.org/housecalls. There you can also find any of the previous shows you may have missed, or maybe you just want to refer back to a couple of them. You can also visit our website there to find them all in one place. Now, this week, as we've been talking about, we are addressing the things that you would like to know surrounding COVID-19 and your heart. We have received some really great questions, and I know the information from Dr. Sperling will benefit all of us. So let's jump right in to the first question. It's coming to us from Allison in Mobile. Allison wants to know, should we get a flu shot this fall, or will that complicate any possible treatment from the coronavirus? That's an interesting question, Dr. Sperling.
Allison, thank you for that question. This is a timely question because it is hard to believe, but we are rolling into fall. And absolutely, this will be the most important influenza season to have a flu vaccine. The CDC recommends an influenza vaccination for almost all Americans, and the American Heart Association recommends influenza vaccination as a Class 1 recommendation for those with a history of heart disease. We will likely have coincident influenza and COVID illness this fall, and all of us should be getting flu vaccines. Discuss this with your clinical team. And you really want to think about getting a flu vaccine earlier in the season. So we're talking about mid to late September or early October this year. What I also want to emphasize is that strategies that we have been utilizing to protect us and prevent spread of COVID will also hopefully affect influenza, the 3 W's: washing our hands frequently, wearing a mask when out in public, and then also watching our distance, our social distance. The other comment here that's a critically important one is the flu vaccine helps prevent flu-related illnesses, but many people do not know that getting a flu vaccine helps prevent heart problems, and we have evidence to support this. So it is a strategy for heart disease prevention as well.
That's fascinating. You're the first person who's ever mentioned that in my presence. So I know that a lot of people at home, I think, will be interested to hear that. I also love the way you put the three W's together. I think that that's a really good reminder for people at home. All right, Marcia from Utah, she asks, how has COVID-19 affected cardiac care in the U.S.?
Marcia, thank you for the question. As this pandemic has rolled out, we know that cardiac care has been affected on many different levels. First and foremost, we saw an early drop in presentation to emergency rooms for acute heart and stroke related emergencies. In addition, there's been impact on continuity of care because there has been focus on the pandemic as a primary area of health systems and hospitals. But the other impact here is that COVID-19 has affected lifestyle and behavioral approaches that are really critically important to cardiovascular care. So I think we have not fully appreciated the impact of this pandemic on cardiovascular care. We may not fully appreciate this for months or even years to come.
Definitely. All right, Toby from Gainesville wants to know, what are the effects of the coronavirus on the heart? I know you've talked a little bit about it, but maybe more specifics if we can.
Yes, Toby, thank you for the question. I mentioned the headline about inflammation of the heart. We call this myocarditis. There appears to be a spectrum of heart-related conditions in the setting of COVID illness. We know that COVID leads to inflammation in the body. This inflammation can be very intense and create a stress test for those with heart disease or with risk for heart disease. That's one manifestation. We also know that COVID is leading to a stickiness of the blood vessels, and we're seeing blood clots both in the arteries and the veins of the body. And then we are seeing what's called a stress-related cardiomyopathy, or we call it a broken heart syndrome. In addition to it, the inflammation of the heart. So heart-related manifestations are not uncommon in those with COVID-related illness.
Yeah, a lot to think about there, Doctor. Thank you. We also have a lot of questions that are coming in, so we're going to take a quick break real quick for another poll question so we can hear from everyone who is watching us from home this morning. So go ahead, grab your phone and get ready to text in your answer. As a reminder, all you have to do is text AHA live to 22333. If you did that earlier on in the show when we were talking about it, you're not going to have to do it again. So just like I said, get ready to text your answer to 22333. So first off, we talked just a little bit ago about getting the flu shot. So we want to know, do you typically get the flu shot every year? So we have our options there. Yes, no, sometimes, but not every year. I have to admit, for the longest time in my adult life, I was more so on the C spectrum, but I'm appreciative that places like my employer, they bring a doctor in here and we get to get the flu shot as an entire team. It's going to look a little different this year with COVID-19. But I'm appreciative of those types of opportunities. Doctor, do you want to weigh in on what you think people should be doing? I know you mentioned get the flu shot, especially earlier.
Yeah, so as I look at this data from our polling question, it mirrors what's happening in our country. And we know that many people do not typically get a flu shot. Definitely those at increased risk with heart-related conditions or underlying chronic conditions should be receiving a flu shot. But I'm going to make the comment that along the lines of the CDC recommendation that almost all Americans should be receiving a flu shot. This is not only to help protect yourself from the flu, but we know that influenza can be transmitted from younger, healthy people to older individuals or those with chronic diseases. And so I hope we'll see a shift in these numbers as we round the corner to influenza vaccination time in the next weeks ahead.
Sure. And one thing I've been hearing from some of our local doctors is, hey, you don't want to get the coronavirus and the flu at the same time. Speaking from experience, not myself personally, but I had a very good friend who who tested positive for both. And they said, even though they had gotten the flu shot, it was rough. And I remember one of the things that they had told me was, I'm so glad I got my flu shot because it could have been a whole heck of a lot worse.
Chelsea, thank you for mentioning that, because I do think there's a very real possibility of the medical term would be co-infection. You can have two viral illnesses at the same time, and we don't yet know how these individuals will do.
Yeah, that's a great point. Thank you for mentioning that. All right, let's ask one more question for now. We'd like to know a little bit more about you at home. So tell us, has a doctor, nurse, or other healthcare professional ever told you you had to do any of the following health conditions? You can kind of check them out on your screen. I know that we're going to get a lot of different answers for this. So we're going to give you a moment to respond. And while you do, let's take a look at this quick video for some good reminders.
Hi there.
Hi.
Couple of good reminders there. All right, let's go ahead and take a look back at our a quiz that we just asked you right before, our poll question rather, right before we watched that video. So a majority of you saying that you have been told you have high blood pressure, cholesterol's on there. I don't see type 2 diabetes or having had a stroke as an option that some of the people are filling in, but yeah, I mean, it's looking like high blood pressure is the one that a lot of people have heard. And doctor, I wouldn't be surprised if maybe even more so since the pandemic began because of those stressors that you were talking about.
Yeah, it's important for all of you to be aware of your heart risk, whether you have a history of heart disease or prior stroke. And as Chelsea mentioned right now, if you have not been in touch with your doctor or your clinical team in some time, because we're now at this for about 7 months or so, it's time to touch base, and your doctor can be available, or your clinical team, through other modes of care, through telemedicine or telehealth if you are not able to get to their office.
I always too think it's important to mention to your doctor and, comment if you think this is valuable or not. But even if I may not have had any of the things listed here, I can say, hey, my mom's had a stroke or my dad died from heart disease. I like to make sure that my doctor knows about the conditions that are within my family so that maybe that helps them look at me in a more clear lens.
Yeah, thanks for mentioning that. You should know your own individual risk, but your family's risk is important. These are conversations often that we don't have with our family members. So learn about your family history of chronic disease issues or problems, especially heart disease prior stroke.
Very important. All right, thanks for answering that. And thank you to everyone who took the time to fill out our surveys. We've really appreciated that so far. All right, we do have some more questions to get to, so let's get to those. This one coming to us from Rick in Texas. He asks, why are emergency room visits for heart attack and stroke down during this current health crisis?
So Rick, these have been great questions. I don't know if we know completely the why, but we do know that as the pandemic ensued, that there was an early drop in emergency room visits for heart attack and stroke. A paper from the Centers for Disease Control and Prevention, published a few months ago, demonstrated a 23% drop in emergency room visits for heart attacks and a 20% drop for stroke. What I do want to emphasize to our viewers here is that there are millions of Americans who are living with a history of prior heart disease and stroke, or at risk for heart disease and stroke, and that these heart attacks and strokes, they're medical emergencies, and hospitals and health systems are taking all the right steps to be safe for your care So if you have symptoms suggestive of a heart attack or stroke, don't wait. Call 911, and you should get to the hospital as soon as possible.
Yeah, I think what's going
And
to be
just a comment, Chelsea. I
no,
should have
please.
answered. So we don't know exactly the why, but we do know a part of the why
Mhm.
is fear. Is fear, unknown, uncertainty, lots of questions, and we initially were sheltering in place, and so by sheltering in place, we were isolated.
Right.
But if you need healthcare right now, it's important to focus on your health, heart disease prevention, and stroke prevention.
Well, and what I was going to say, doctor, is I think what is going to be telling in the future is, of course, we're already seeing a significant amount of deaths from the coronavirus. Okay, so what are the deaths that we're going to start seeing that could have been prevented had people just went to the hospital and worked with their healthcare providers? All right. Jenny from Telluride asking, if I have a serious heart condition, what are my chances of surviving the coronavirus? Really good question.
Yeah, so Jenny, as you can imagine, I get asked this question many, many times by my patients, by neighbors and family members. For an individual, I don't think we can answer this question, but what we can say is there is evidence for those with serious health conditions, history of heart disease, prior history of diabetes, chronic lung disease, that from the CDC as well, from a publication over the last few months, we know that those with serious health conditions are 6 times more likely to be hospitalized related to COVID illness, 5 times more likely to be admitted to the ICU, and 12 times more likely to die of COVID-related illness. So if you do have a history of heart disease, and specifically a weak heart muscle, a cardiomyopathy, a history of heart failure, coronary artery disease, so you've had a heart attack, a stent, a bypass surgery, these are higher risk conditions. And so you should take all the right precautions we discussed earlier, and those around you should as well.
Absolutely. All right, our final question coming from Lawrence in Milwaukee. They ask, if I already have a risk factor like hypertension or diabetes, what do I need to know about staying healthy during the pandemic?
Thank you, Lawrence. A question from another Lawrence. So there's never been a more important time than during this pandemic to make heart health and heart disease prevention and stroke prevention a priority. So if you do have heart-related risk factors, high blood pressure, diabetes, you should be taking your medications regularly, ideally to have a 90-day supply. You should be touching base with your clinical care team for your routine follow-up, but especially if you have questions or concerns. And then importantly, this is a time to focus on your health. And many right now are not for various reasons. So focus on proper nutrition, regular, moderate physical activity. And then this has been a very stressful time for many, a time of isolation. And so you really, although we are socially trying to keep distant from others in terms of physical proximity, you definitely want to be focused on social support. So reach out to those you care about, and it's a time to take it one day at a time, and together focus on heart health and heart disease prevention.
Yeah, I appreciated that reminder. Focus on yourself. I think that sometimes we really need to be told that, especially from someone, with your background. So we appreciate that. And we appreciate you thoughtfully answering every one of those questions. So a big thank you from all of us for that. All right, let's move on to our next segment. That is, what would you say? And what would you say? We want to hear from all of you at home. If you have been with us throughout the show today, you already know what to do. Grab your phone, get ready to text your answer to 22333. So to start, let's have a refresher course in virus prevention. So tell us, which of the following do you think is the most effective in preventing the spread of germs? Washing hands with soap or using hand sanitizer? This is a good question. I'm interested to see what our viewers have to say about this one. Dr. Sperling, do you want to weigh in on what you think is the answer, or what you, I'm sure, know is the answer?
Yeah, so I agree with our viewership here. So washing your hands with soap. What's important too is the time that you're washing. So you really want to wash your hands for about 20 seconds.
Okay.
Uh, and so frequent hand washing, adequate hand washing, and then also being aware that our hands frequently are touching our face and our eyes and our mouth. And so being more cognizant of that as well.
Yeah, and I've watched certain videos of people who have just put their phone maybe on the ledge of their desk and did a time lapse of themselves to see how often they really do touch their eyes, their nose, their mouth. It is way more than any of us think. So just keep that in mind. All right. So it's looking like a lot of you are saying yes, the washing hands with soap. All right. One question for you. So many of us have either worked from home or are still working from home during this time. And there is a lot of talk of how to make this shift, or how the shift rather might actually remain a more permanent change in our society. So we want to know, are you expecting to go back to an office environment, or will working remotely or from home even be a permanent situation for you? I'm interested to see what people have to say for this, because I know a lot of big companies and corporations around the country are already saying until the end of next year, some of these big corporate CEOs and whatnot will be working from home. So it's looking like my job will remain remote. That's what some of our viewers are telling us. Some people are not sure yet. I know that you were mentioning, doctor, had to change your workflow quite a bit.
Yes. So the answers for those who are viewing reflect those uncertainties as well. And we have uncertainties day to day right now, but many life-related uncertainties. I've had to adapt. The CDC primarily is working from home. I frequently travel related to my position, and so I've been working remotely. And these days you can be virtually anywhere in the country or anywhere in the world from your home office. I do want to add an important quote from Albert Einstein. He said, "In the midst of difficulty, there are opportunities," and so we should pay attention right now as we are going through very difficult and very challenging times. That we are learning a lot about the capabilities of our work environment, but we're also learning about our own individual and family and community capabilities.
Sure. I'm seeing a lot of people answering choice C there. It says my job will likely be a hybrid where I work a little bit from home and I work from the office as well. So I encourage you, if you answered that, the recommendation C, go ahead and comment as to how you feel about that. I'm interested to see if people actually are enjoying that. I have to say, I did have to work from home for 2 weeks at the start of this pandemic. So I was literally anchoring my evening newscast from my bedroom. And I feel so fortunate to be able to come into a studio and work. So I don't know how I would do with that. So I appreciate all of you who are having to really make such big adjustments in your everyday life. With that said, Dr. Sperling, thank you so much for keeping us all up to date throughout this pandemic. There's just been so much new information. And so much I think that we still don't have all the answers to, as you also alluded to. And the science, it is constantly evolving. And so we appreciate you taking this time to really just bring us up to speed, given what we do know right at this very moment. So before we let you go, do you have any final thoughts you'd like to share with us today?
Just final thoughts. There is a lot we don't know. Right now is a time for all of us to focus on prevention at an individual, family, and community level. And this relates to heart disease and stroke prevention, but also prevention related to COVID-related illness. And so it's really been wonderful to join all of you here today. And I appreciate the invitation from the American Heart Association.
Well, we have loved having you, and I hope you have a great week.
Thank you.
Before we do sign off, we have one more thing to share with you, and that is our weekly health hack. Health Hacks is brought to you by Stories of the Relentless, the American Heart Association's podcast. You can go to heart.org, iTunes, Spotify, or Google Play to find it. There you'll find many amazing stories and conversations on a variety of topics. So I encourage you, go check it out, subscribe, share your thoughts in the reviews, and share it with your friends and family. Okay, this week's health hack comes to us from Deborah. Hello, Deborah. She has some ideas to keep us cool and hydrated this summer using ice cube trays. First, use fruit juice or fresh fruit with water to make frozen flavored ice cubes. Pop them in sparkling water to add some flavor. You can also freeze a tray of coffee cubes, then add a couple to a glass, pour your coffee over that, and stir with a little bit of low-fat milk, and then you get your iced coffee that is never watered down. Love that tip, Deborah. So a big thank you for that. I'm a huge iced coffee drinker, so I'm going to definitely have to take that into consideration the next time I make myself some. All right, remember, we do feature a new tip each and every week. So if you have a great idea, send it to us at heart.org/housecalls, and maybe you will see your idea live on this show. You can also find all of our previous shows there. Don't forget, each week there are always more questions and answers than we get to. We have time to answer. So if we didn't get to yours, we'll work to answer as many of those on our House Calls after show. You can look for it Wednesday or on our social channels and on the AHA's podcast. Thank you all so much for spending your time with us. We hope you'll join us again in the future for our episodes. Once again, I am Chelsea Helms, coming to you live from the KNWA News Studio in Fayetteville, Arkansas. Thanks for watching. I hope you all have a wonderful week.
Home is meant to be our safe place, but heart attacks and strokes don't stay home. Don't avoid the ER out of anxiety. Don't die of doubt. Don't stay silent, and don't stay home. If you have an emergency, call 911. When seconds count, the hospital is the safest place to be.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at